Hello, can you tell me your name?
John.
John, what brought you to our office?
I have been heading for a knee replacement, and I'm still an active athlete, and I'm still way too young to get a knee replacement, so I looked into options. And in looking at a bunch of different providers who had the offering that I needed, Raynham Regen was the place. If you can have it wrong with a knee, I have it. I have Osgood-Schlatter's disease. I have a slightly displaced patellar tendon. I have osteoarthritis tricompartmental. I have degenerative arthritis on the end of my femur with my articular cartilage. I have a patellar tracking syndrome problem. I have a torn meniscus lateral side. So there's a lot going on in there. And it got to the point where I couldn't even get it scoped or get the meniscus fixed. Insurance said they would not let anybody go do anything if it wasn't to replace the knee.
And we did the procedure, which was a tissue injection,
Yes.
which contained growth factors and stem cells, approximately 7 weeks ago. How has this changed the knee at this point?
It's been amazing so far. The first few weeks, honestly, I didn't feel much. I didn't expect to, though. Obviously, with everything I was told, I knew how the process worked. But I've lived most of my adult life with just an ache. Like my knee would just ache every day, to the point where I didn't even think about it. Never a thought, because it was just every day. The last 2 weeks, it's not there. It was enough to make me notice it, because I'm so used to it being there, that I'm noticing that there's no ache in my knee. Like I wake up in the morning, I'm just like, oh, there's my knee, and it's not there. There's no, that ache isn't there. The flexion is smoother. My knee used to make a lot of snap, crackles, and pops when I would squat or do lunges, and it's quiet. There's no noise. There's no snap and crackle and popping. There's nothing. Well, we're early in the process, so I'm still rehabbing everything. But mentally, for me to be able to squat down and not hear my knee crackling all over the place is huge for me. It gives me hope that 6 months from now, 8 months from now, I can get back to running, because I was pretty much told my running career was over. And as a triathlete, it's a big part of the game for me. This gives me a lot of hope that by the time this process kind of rolls itself out, I can get back to racing.
Yeah, that's awesome, John. And this is continued to improve with time. Are you happy with your decision?
Absolutely.
Is it something you'd recommend to other people?
Absolutely.
Okay. Thank you, John.
You're very welcome.